everyone, my name is Nazmie Nurtsalis, a student from the Bachelor of Pharmacy program at Bakti Tunas Husada University. Today, I'll be presenting a topic that may sound simple but has a major impact on our health. The topic is, why do some medicine need to be taken before meals and others after? Have you ever taken medicine and wondered, should I take this before or after eating? Many people ignore this instruction, but it's actually very important. Whether a drug is taken before or after meals can greatly affect how well it works, or whether it causes side effects. The reason is simple. Food affects how drugs behave in the body. It can slow absorption, block effectiveness, or even cause harmful interactions. The World Health Organization reports that nearly 50% of treatment failures happen because patients don't take medicine correctly, often because of poor timing. From a pharmacological point of view, this is related to absorption and metabolism. On an empty stomach, drugs are absorbed faster. But if the stomach is full, the food may delay or interfere with the medicine's movement into the bloodstream. That's why timing matters so much. Here are examples of medicines that must be taken before meals. First, levothyroxine for thyroid problems must be taken on an empty stomach because food can reduce its absorption by up to 40%. And alendronate for osteoporosis is almost completely blocked by food. Iron supplements are absorbed better without food, especially dairy. And last, proton pump inhibitors like omeprazole should be taken 30 minutes before eating to reduce stomach acid effectively. Now, let's talk about medicine that must be taken after meals. Why? To avoid irritating the stomach. For example, ibuprofen and aspirin can damage the stomach lining if taken on an empty stomach. Metformin, a diabetes medication, often causes nausea. Food helps reduce this effect. Doxycycline, an antibiotic, should be taken with food to avoid stomach upset. It's not just when you take the medicine, but also what you eat. Some foods can dangerously interact with drugs. Milk and dairy reduce the effect of antibiotics like tetracycline. Cheese and processed meats can cause dangerous blood pressure spikes if combined with MAO inhibitors. Grapefruit juice blocks liver enzymes, increasing the strength and risk of drugs like statins. There's strong scientific evidence behind all these recommendations. A student found that coffee reduced levothyroxine absorption by up to 64% when taken together. Iron absorption can be reduced by 90% if taken with milk. Alendronate, according to the Merck manual, is almost not absorbed at all when taken with food. This shows why instruction must be followed carefully. Many patients make mistakes like taking all medicines together without reading the label, ignoring the instruction, take before meals, stopping medication early just because they feel better. The small mistakes often lead to failed treatment or bad side effects. So, how can we take medicine correctly? The answer is always read the label carefully, ask your pharmacist if you're unsure, follow specific instructions like before food, after food, or on empty stomach. These instructions are not optional, they are essential for safe and effective therapy. When in doubt, ask your pharmacist. They are trained to understand how medications interact with food, other drugs, and your medical condition. Their advice could prevent dangerous mistakes and make sure your treatment works as it should. Here's the main takeaway. Before or after meals is not a small detail. It's a scientific instruction designed to make sure your medication works properly and safely. Respecting this timing can make a big difference in your recovery. Let's take our medication the right way. Share this information with your family and friends because medication is only effective if used correctly. Not just by what you take, but how and when you take it. Thank you for watching and see you in the next video. Bye bye.